Hi, Miss Brown. I'm glad you made it here today again.
Hi.
So, tell me, how are you feeling today?
I'm doing good, thank you.
Okay. In what way you think you're doing good?
Um, well, I was able to get out of bed this morning and come because, as you know, as I told you the last time I was here, that I'm having a hard time getting out of bed.
Okay. All right. That sounds good. So you feel as though you're improving.
Yes.
Okay. Let's do a mood check. On a scale of 1 to 10, with 10 being the best you've felt and 1 being the worst. How would you rate your feelings?
About a 5.
About a 5. So you're in between.
Yes.
Okay. What would cause you to be feeling in between?
Well, initially when I came because I was very, very depressed.
Okay.
And when I was here the last time, the lessons or the project that they give me as homework, where you said I should, every time I feel sad, try and figure out why I was feeling sad and to focus on, why I was feeling sad. So, yeah, that helped me a lot.
Okay. So, making a list of your thoughts and feelings
Really helped me.
really help.
Yeah.
Okay. Well, today we would like to, first of all, set an agenda. You know what we'll be talking about today.
Okay.
Firstly, I'd like to obtain an update on your day or your week.
Okay.
And how you did this week, and we'll review your homework.
Okay.
Then we'll decide, or you will decide, what problem you'd like to work on, or probably we could work on it together.
Okay.
And then we'll talk about cognitive skills, and we'll set homeworks.
Okay.
Because apparently you really appreciated the homework that
Oh,
we
yeah.
did the last time. Then we'll work on second problem if we have time, and following that, at the end, I'll provide a summary of the things that we've discussed and the homeworks. We'll summarize everything, and then we'll review your new homework assignment. Finally, I'll get some feedback from you on how you think the session has gone. Are you okay with that?
Yes.
Okay. Tell me, Miss Norma, how has your week been?
Well, this week, out of all, since the last few months that I was experiencing that slight depression, which you said it was depression,
Right.
I've gotten up on time every morning as you suggested. I do some homework. I make my breakfast because you told me I should try and eat something instead of going without making myself some breakfast. And I've gone for a walk around my complex as you suggested. So
Oh, wow.
those are some of the things that I did this week.
Okay, so it seems like you accomplished quite a bit.
Yeah.
You are getting up in time. It's wonderful. I want to commend you for that.
Okay.
You're doing your homework.
Okay.
Great. You're preparing your meals, which is very important. Self-care, taking care of yourself, and also you're walking around the campus. And you're saying that affect how you're feeling.
Oh yeah, I mean that totally changed my mood comparing to the last couple of months, as I said, when I was feeling depressed. Because I wouldn't get up out of bed until maybe 1, 2 o'clock in the day. But I've been up like 8 o'clock, I've been up 9 o'clock all of this week. So.
Okay, wonderful. Well, as I look at your homework, which included setting a schedule for getting up, a schedule, you were to include doing your homework on a schedule, preparing your meals. It seems like you have done a marvelous job in fulfilling the responsibility that you had assigned.
Thank you.
That's wonderful. Okay, now what would you like to talk about today?
Well, now that I'm feeling a lot better, I was wondering if you could help me to find some kind of agency where I could get them to help me find employment, because I've not been successful in finding employment.
Okay, so you want my help in finding the employment.
Mm-hmm.
Okay, that's one. Any other issue you'd like to talk about today?
No, I probably would like for you, I'm now ready to address the fact that my girlfriend died, and I wanted to hear if you think I should go and get some grief counseling.
Mm-hmm. Okay, so you want us to address the fact of the death of your girlfriend and how you ought to handle it, or whether you ought to
Get some
go
grief
get some
counseling.
grief counseling.
Mm-hmm.
Any other issue that is pressing on you?
Not right now, no.
Are you sure?
Yeah.
Okay, so you'd like my help in finding you an agency to work on your job preparation. Tell me, Ms. Brown, how have you dealt with your job preparation? How prepared you think you were for job application? Do you think you were prepared?
Yeah, well, I've been the one who sent out my application. I wrote my resume, and I've been using it for years to find employment. But for some reason, it's now over a year since I've not found employment, and I was wondering if you could make any kind of suggestion.
Okay, well, I know of an agency right here in Collegedale that would be willing to work with you. They have a program to prepare people for jobs.
Mm-hmm.
Now, how the program works, if I may explain to you, is that you'll have to attend the sessions for about a week or two. Do you have the time to attend the sessions?
Yeah.
What they do there, Ms. Brown, is that they want to help you prepare your resume so that it looks real professional.
Mm-hmm.
And then they talk to you about how to go about getting a job interview.
Mm-hmm.
Then at the end, as you feel comfortable, they would teach you how to dress, and dress to prepare you for the interview.
Okay.
And then they will have a mock interview. Now, this mock interview is very, very interesting to me, in the sense that they invite real employers to come to the mock interview.
Okay.
And so the likelihood of you getting a job after the mock interview is very high.
Okay.
So you will dress the part, and they will work with you to get you prepare you for the job. Does that bring some hope to you?
Yeah, it sounds good. I would have really appreciate you giving me that information.
Right. I'll actually, I could hook you up with a person. I could call that person as soon as our session is over.
Okay.
And I will recommend you that they accept you for the course.
Perfect.
How does that sound?
Oh, perfect. I
Wonderful.
appreciate that.
So, Ms. Brown, does that help you with your? Does it make you feel good about the solution for this problem?
Oh yeah, and I'm looking forward to going to this place to talk with the person that you're gonna give me reference to.
Okay. Now let's work on another problem.
Mm-hmm.
Okay. The other problem is that how you could handle the grief of your girlfriend dying. Now, explain to me. Is this the first time you've had someone close to you passed away?
No, but she's my very good friend. She's my children's godmother, and I would call her daily. So it's been difficult now because every time I think about calling her, then I remember she's dead.
Wow. Okay. Now, okay, yeah, I could empathize with you on that in that area because yeah, it could be tough. But now, you said that. How have you dealt with? You said that someone had died close to you before.
Oh yeah.
How did you deal with that? What solutions did you?
Actually, I just thought I ignored that one. I haven't gone through the grieving process yet. I still have not gotten grief counseling for that because what I did was I put myself in school just not to think about that. But now with my friend, because I used to talk to her daily, it's causing a little stress.
Okay, so if I'm hearing you correctly, is that enrolling in school had helped you in taking your mind off the death of your loved one.
Mm-hmm.
But you know, Ms. Brown, I'm really sorry to hear that, and but I'm also glad that you decided to be proactive about doing something about handling that death. Okay, so how have you dealt with this situation before?
What situation?
With the death of with someone dying, what things besides going to school?
Oh, I mean, that's it. As I said, I just totally ignored the fact that, I needed to probably do grief counseling or anything like that. I just decided to go back to school and just try not to think about it.
Okay. Well, would you mind if I make a suggestion on an activity that I believe could help you?
Oh, I don't mind at all because the homework that you gave me from last week was very helpful. As I told you, I got out of bed, I made myself my breakfast, I wrote down all the negative things I was thinking. So yeah, please, anything you suggest, I'm willing to try.
Okay. Well, one technique that I have worked with other of my patients is refocusing their minds from their current negative thought. Okay. Now, how does this work? Is that whenever a negative thought comes to your mind, you stop what you're doing, and for 2 to 3 minutes, you focus on that negative thought. Then when you think the 3 minutes is over, you say stop.
Okay.
You know, it would be nice if you say it loud, say it out loud. Or what you can do is that at the end of the 3 minutes, you can wear a rubber band, and you pull the band. If you can't say stop loudly, you pull the band and you let it go, so they give you a little sting in your hands.
Okay.
Yeah, and after that, after you've done that, then you refocus you refocus your mind on what you're doing or something more positive.
Okay.
Do you think you'll be able to do that? How does that sound to you?
Sounds good. I'm not sure if I'll use a rubber band to sting myself, but sounds like something I would want to try.
Okay.
If it will help me, like the last homework that you gave me.
Okay. So then you think you'll be able to accomplish this assignment?
I'll try.
Okay. All right. So, Ms. Brown, we have worked on 2 of your problems. We've worked on finding you an agency who will train you and make you feel better about, well, not only feel better, but better prepare you to face your job search.
Okay.
All right. This agency is very nearby to where you live, and as I said, I will talk to them and I'll recommend you to them. How does does that sound to
That's
you?
fine.
All right. We also discussed how you could deal with your girlfriend's death,
Mhm.
in that you try to refocus. You know why I suggested that is because I noticed that the last time when you came here, you enrollment in school sort of helped you get your mind off that situation with your mother.
Mhm.
Now this technique is a little similar, you know, in the sense that, but it's just that it's more, it's going to be more proactive on your part, in the
Okay.
sense that you will focus on the thought that is the negative thought. After 2 to 3 minutes, you say stop, and then you refocus on something more positive.
Okay.
I'd like to assure you, Ms. Brown, Narama, that it's not going to happen overnight. Okay, you getting into the habit of refocusing from a negative to a positive.
Mhm.
It will take practice.
Okay.
So hence the reason for my assigning you this assignment. It will take practice, practice, practice. Are you willing to commit to practicing?
Yeah, I'll give it a try.
Okay. Well, we've reviewed your homework assignments,
Okay.
and now we want to know that it seems like our time is coming to an end. I'd like to get some feedback from you, Ms. Brown, on how you think the session went.
Well, I think it was very good because I certainly appreciate the information that you gave me. One, that you're going to help me to find this agency that will help me to work on my resume and my interviewing skill. And the suggestion about trying to stop myself from thinking negative thoughts.
Right,
Because that's what I was doing before when I came here last week.
right.
And just thinking positive is good. And what I was doing was writing it down, write down what I think. But now you're telling me that I need to do something in order to counteract
Right.
that.
Right.
So that's good. I'm gonna try it. I'm not promising that I'll do the rubber band though. But
Okay. That was just an alternative if you feel brave enough to sting yourself, but you don't have to. You know?
Okay. So that was just an I don't know if I'll do that, but I'll definitely try to think of a way to do the homework.
Okay.
Yeah.
Now, is there anything else is there anything that you feel I could do to make your sessions more better?
Oh no, I mean, I've never been to counseling before, and coming here, I've learned a lot about myself and some of the issues that I'm experiencing. So, I mean, there is nothing else that I need to talk about, and I certainly appreciate you taking the time to help me, because I wasn't sure that I would have been able to get that type of help.
Well, thank you for coming in and taking the initiative to come and get counseling for your depression, and also being proactive in seeking a place where you could be prepared to get a job.
Okay.
When would be a good time for us to meet again? Next week?
I'm not sure. What time do you want me to come?
Well, would the same time be okay?
Yeah, definitely.
Well, Ms. Brown, I'm glad you came.
Thank you.